Hello and welcome. Many thanks for the very kind introduction. In the next several minutes, we will have a look at the Western Europe area and social and logistical barriers to the implementation of PrEP. Upfront conflict of interest. So over the last years, very fortunately, the ECDC has sort of evolved into a very good data collecting and data distributing center for anything regarding PrEP in the HIV arena as well. So there are several publications that can be used as reference publications when it comes to questions around implementation and access and distribution of PrEP in Europe. That's the last status of formal PrEP implementation in Europe. So you can see we're supposed to focus on Western Europe at the moment. So Western Europe can be considered in terms of PrEP, a very much implemented place. So in most countries, PrEP is nationally available and also reimbursed. And you can also see that further east or further south you go, the less likely it is that PrEP is nationally available, implemented, reimbursed, etc. There have been several surveys quite early on from the start of PrEP being approved by the European Medical Agency. One of these has been derived in Germany from the Robert Koch Institute. It's called the EMIS survey. And they were asking MSM, men with sex with men, several questions. And most respondents, as you can see in the map to the right, were answering from Western European countries. And amongst many questions, they were also asked, have you ever heard about PrEP? And that's already 3 years ago, these data that have been published last year. And you can see that 63% actually said that they have heard about PrEP already, and that applies to the year 2017. And then there have been other surveys and publications with also a very large number of respondents, and that is also focusing on the MSM population. And they have been asked, in addition to having heard about PrEP, are you currently taking PrEP? And that's where the numbers are going down. So you can see only 10% out of more than 10,000 respondents, HIV negative MSM, has said, yes, I'm actually currently on PrEP. And that hasn't changed since 2016. So that's the clear indication that we do have a PrEP gap also in Western Europe, particularly among the MSM population. And very luckily, there's also some guidance, or at least some data from the European CDC highlighting how implementation processes are going, where the PrEP gap actually has to be located. And these are the absolute numbers, the current ones we have to date, showing you the people having received at least once PrEP. And for Germany, for instance, it's 8,000 people. Austria, it's 757. In France, it's close to 10,000. And again, the further east you move, the less likely it is that people have actually received PrEP. And when you then compare the people who would like to be using PrEP to the ones that are currently on PrEP, that's where we then get to the PrEP gap. When you can see to the left, the further east we go in Europe, the bigger the PrEP gap is, and the further we move towards Western Europe, that's sort of closing the PrEP gap. But so the maximum you can see is close to 45% PrEP gap. And the smallest one you can get is actually in Portugal, 4.3. And if you look overall in Europe, that's a delta of 17.4%. And that's more or less the difference actually we see in the Western European countries. So we have a PrEP gap of 17.4% in terms of accessing PrEP. So what are the limitations? That's also derived from the same publication. High importance is shown in blue. It's the cost of the drug, it's the limited technical capacity, and cost of the delivery service. So it's not medicine itself, but it's the surrounding environment in terms of logistical support, clinics offering PrEP services, and in a lot of countries, apparently cost of the drug seems to have played a role. And then the next question, of course, is where do people in Europe actually get access to PrEP? And this is a nice distribution showing you the access via physician, research study, internet friends, or other services. And that gives you the quite astonishing percentage of 54% of the participants that were taking part in the survey saying that they were actually having informal access to PrEP, so outside of the medical system. And that's, of course, something that we shouldn't tolerate on the long run, because you need to do toxicity checks, STD tests, particularly HIV tests, and people should actually get access through PrEP via the medical system and not outside. And the next barrier and the most current barrier, which has social and also logistical implications of two also PrEP services, of course, the Corona or COVID pandemic. We are meeting online as a result of this as well. And those are the news data I can show you from Germany. There's a national evaluation of PrEP outcomes and STIs ongoing. And apologies that it's in German, but the graphs are internationally readable, at least the colors. So if you look down to the bottom, the blue bars is the time frame between September and December last year. And the orange bars represent the time period January to March 2020. And you can see that the overall numbers of patients or people being on PrEP hasn't changed between the two time periods. But if you then look at the ones that were newly put on PrEP or had access to PrEP clinics, then the numbers really went down significantly in several parts of the country. And that's particularly true for the, unfortunately, for the bigger cities like Hamburg, for instance, as well. So of course, coronavirus has taken its toll for PrEP clinics as well, and less people actually had access to or were seeking access to PrEP, which is particularly worrisome because now that quarantine is sort of on and off, lockdowns are activated and deactivated, and then people might end up being not on PrEP and having sexual contacts. So if we have a look at the estimated PrEP gap, we saw that it's overall, it's rule of thumb for the European region, it's 17.4%, so there's still some work to do. We can definitely see that those the MSM that actually want PrEP are also the ones that are at risk of acquiring HIV. So anyone who's seeking PrEP, at least at my clinic, is also offered, and most of them also go on PrEP because they actually have a clear risk of getting infected with HIV. And if we assume that close to 2.8% of the adult male population are MSM, then you can come up with a number of 500,000 MSM who want or who are in need of PrEP in the EU who currently don't have any access to PrEP. And that's quite an astonishing number. And that, of course, has an impact on the 2020 or 2030 targets that have been announced by the WHO. And you can clearly see that if we don't implement PrEP better in all European regions, then of course we will not reach the targeted numbers, which we will not reach anyway because Corona has also, of course, taken its toll on the in the HIV field. And in addition, with reduced PrEP services, that also has a toll on testing for HIV. So once in a while, we pick up an HIV diagnosis when someone comes newly to our clinic to ask for PrEP. And my country is not doing a very good job in terms of getting the numbers of late presenters down. You can see to the right that in the MSM population, a third of our patients is diagnosed at a CD4 T cell count below 200 or with an AIDS-defining illness, a third. And if you take the threshold to 350 helper cells, which is the threshold for a classical late presenter, then it's around 60%. So the majority of HIV patients, even in a very well medically established country like Germany, gets their HIV diagnosis at a late or very late stage. And of course, PrEP clinics also offer the chance that MSM that regularly don't have any access to the medical system get access and then get tested for HIV. So in conclusion, I think we can clearly see that formal PrEP rollout has been slow, and that's particularly true for the eastern parts and Central Europe, but also for the western parts. As a result, and people are connected online, there's a significant number of informal PrEP users across Europe. We can come up with a significant PrEP gap of 500,000 MSM in Europe who should actually be on PrEP. And of course, if we don't scale up our PrEP efforts, then all HIV eradication global targets or even local targets will never be met. So PrEP is a crucial part of any elimination programs for HIV. Thank you.